Hello everyone, I'm Jens Lamanton Garcia, a postdoctoral researcher from the University Hospital of Cologne in Germany, and I would like to share with you the publication Exploring Invasive Fungal Infection Diagnosis and Treatment, a cross-continental comparison between Brazil and Europe. The reason why we started with this research was the fact that Brazil and Europe face unique invasive fungal infection challenges. In the case of Brazil, we are speaking about a country with diverse ecosystems, with a high rural workforce and prevalent health conditions that predispose inhabitants to invasive fungal infection. And in the case of Europe, we speak about a continent with invasive fungal infections linked to transplantation, intensive care unit stays, or chronic diseases. This research is coming from a global effort expanding or in order to expand mapping of diagnostic and treatment resources for invasive fungal infections. And specifically in this publication, we wanted to undertake an online survey to decipher the current diagnostic capacity and availability of treatments for invasive fungal infections in order to guide healthcare professionals, patients, and policymakers, making a comparisons between Brazil and Europe. We collected data through an online survey and from different bodies that could provide relevant data regarding the access to diagnostic and treatment tools. The initiative was started in South America and it was expanded to other continents until we came to this comparison between Brazil and Europe. There were statistically significant differences almost in all the variables analyzed, with more access or with a higher access in Europe as compared to Brazil. And this is the case for on-site microbiology laboratory, mycological diagnosis performance, not in the access to microscopy, but we observed statistical significant differences again in the access to culture, also in the tests available for species identification or the antifungal susceptibility testing technologies. Again, differences in antibody detection, specifically in the ones for Aspergillus species, in the antigen test detection for Aspergillus, for Cryptococcus, and also for Histoplasma and beta-D-glucan, and also in the access to molecular tests to Aspergillus PCR, Candida PCR, Pneumocystis PCR, or Mucorales. In all the cases, the access larger in Europe or higher in Europe as compared to Brazilian institutions. Regarding pathogens perceived as most relevant, in Europe, it's significantly higher the relevant perceived for Aspergillus, Candida, and Mucorales, while in the case of Brazil, this is for Cryptococcus and Histoplasma. Regarding the access to antifungals, in all the antifungals, the access is higher for European institutions. The only place where we observe higher access of Brazilian institutions to a certain antifungal is in the case of amphotericin B deoxycholate and amphotericin B lipid complex. Regarding echinocandins, we see always a higher access in Europe and actually being this statistically significant. And regarding triazoles, also larger access to these antifungals in Europe as compared to Brazil. And this is statistically significant in the case of itraconazole, posaconazole, and voriconazole. And last but not least, also larger access to therapeutic drug monitoring and being this significant uh, in Europe as compared to Brazil. So with this, we could drive or we could get these conclusions. The first one is that there are striking differences. Brazil's healthcare system has some disparities and limited access to advanced care impact that it's relevant for the diagnosis and management of invasive fungal infections. While in the case of Europe, there is a widely established healthcare infrastructure that facilitates early detection and treatment of invasive fungal infections. And also, Brazilian institutions overall, unfortunately, are quite far from excellence standards. And this comes with a call of action or call to action towards improvement of capabilities in Brazil. And this call to action may have different points. The first one is Brazil is expanding public funded antifungal armamentarium. The Brazilian Ministry of Health is also providing wider access or has to provide wider access to diagnostic tests, particularly in people living with HIV. There is a need to increase involvement of scientific societies, and additional work is needed. In fact, there has to be an increase of overall access to both diagnostic tools and antifungals in all the regions. And please stay tuned because a new survey is underway with data not only from Brazil but also from the rest of the countries from the Caribbean and Latin America. Thank you very much and see you in the next video.